Ascension St. Vincent's, Clay County, and then he will also lead us in the Pledge of Allegiance. Reverend Jarvis, if you'd stand.
Are you on? I guess the light has to be on. Okay. All right, let's pray. Our Heavenly Father, we thank you for this day. Lord, even as we come into this facility with all of the rain and the thunder and the lightning outside, we're reminded of all the chaos that seems to be going on around us in our world. And yet, Lord, I'm also reminded of the power of who you are and your willingness and desire to bless us and to meet our needs. And so, Lord, I just pray that as this body meets this evening, Lord, that you would instill in them wisdom that is important for making decisions, and Lord, that those decisions would be made in the best interest of our children and the future of Clay County and elsewhere. Lord, we just thank you for loving us, and we just commit this time to you right now that you'd accomplish your plan and purpose. For it's in your name that we pray. Amen.
Amen.
Will you join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And thank you, Reverend Jarvis. The Clay County School Board meeting will come to order August the 6th, 2020. Welcome, citizens of Clay County. I want to take this opportunity to thank you for taking the time out of your busy schedule to attend tonight's school board meeting. This meeting is our opportunity as your elected representatives to collaborate openly and make decisions that will decide the future direction of our public schools and the education of our children here in Clay County. If you wish to address the board on an agenda item, there will be an opportunity to speak for 3 minutes. Please fill out a card, which you will find located in the back of the room, indicating the specific item, number, or topic you wish to speak about, and turn it in promptly. No additional cards will be accepted once the board moves to the public comment section under presentations from the audience. No public comments were submitted via the comment link on our website. Your participation is welcomed and appreciated. And let me note for the record, Mrs. Kiraskis is attending electronically tonight. You'll see her on the big screen. So,
Mrs. Studdard, I'd just like to say thank you for allowing me to participate in this manner, and I hope that it was not an inconvenience for anybody. Thank you.
we're good. Thank you. Okay, recognition and awards, Department of Health presentation. Heather Huffman, Director, the Department of Health in Clay County. And board members, you got paperwork too.
Good evening. Good evening. Trying to make sure I do all this electronics correctly. So I've been working along with Terry Dennis, your Chief of Staff, and Mr. Broski for months now, at least daily. And they've asked me to come to really brief you on the status of where we're at related to COVID. And so hopefully we'll be able to answer some of those questions and have some dialogues back and forth. And we'll go from there. So I gave you quite a few handouts, a lot of light reading this evening, apparently. So the first thing that we want to go over is really where are we at in Clay County? Because, you know, a lot of people see national numbers. Our local news stations do come out of Jacksonville, so you get a lot of Duval County data, but it's important to know what's happening here. It's important for me in public health to know what's happening in our surrounding county, but I truly need to know what's happening here. So if you look at cases, and this was data as of through last night, we had a little over 3,100 cases in the county. It's important to look at how many cases are reported every day, but it's also important to look at what kind of cases those are as far as the demographics that are in those cases. And the median age range is really, really important as we've learned a lot about this disease in the last 4, now almost 5 months. We do know, and what we've been able to see through the cases and the mortality is really who it impacts the most and who has the greatest likelihood of having a poor outcome. And so we do know through these 4 months that those that have underlying health conditions, those comorbidities as we talk about, and those of individuals 65 and older are going to have a likelihood of having a less of a good outcome. And so it's important to look at that. So if we look at the last few days, you're going to see some dips in numbers there, the 8.2, 8.3, 8.4. Again, that's because our state testing sites, including our county testing sites, were down because of the storm, the impending storm, and those results were, those days that they would have come in. And then you get a little bit of a backlog there, so that's where you get that uptick there. So it's always important to look at the numbers, and if you see a dip or an increase, it's like, okay, why did that happen? Is it truly a case increase or a case decrease? No, it's probably something else that maybe environmentally that changed that. And then looking at the median ages, it's still hovering in those lower 40s. You have some blips a little higher than that. But overall, for all of our cases, our median age has been 43. So that's good to know. At one point, we were first in this and we had, just small numbers. Unfortunately, it did hit some of our most vulnerable in our long-term care facilities. And so our median age was way up in the 50s and 60s. And that is concerning when we know that that's who it's going to impact the most. In that middle section, it talks about race and ethnicity. That's probably not as important to you guys per se at the school district. If you look on the right-hand side of that county report, it talks about hospitalization. 7% of our total cases have been hospitalized. That does not mean currently hospitalized. That means ever hospitalized, and that could have been just one day. Okay, and then if we look at deaths, we've had 50 deaths. And that's 2% of our cases. So we have around a 2% mortality rate in this county for COVID. And I will tell you, knowing most of those deaths and who it's been, again, it's your older individuals. It's hit a lot of those long-term care facilities that live in a congregate living setting that it has impacted the most. The bottom part of that diagram really gets to your cases and really delves them into it in age groups. And I think that's important for this group. When we look at all the cases, and then you have your new cases just were represented that day, but also your hospitalizations and your deaths. So if you look at it in our 15 to say 64-year age range for all cases, that's where the bulk of our cases are. However, if you look at hospitalizations and deaths, you can see where we've had a lot of cases in the younger groups, but they tend to probably be asymptomatic. They don't need hospital care to recover if they have mild symptoms or even medium level symptoms, and they tend to recover fine, and we don't have issues with mortality. So that's a great diagram and depiction to you of what looks like when we look at morbidity and mortality rates. And please stop me at any time if I'm going too fast.
I have a quick question.
Sure.
And I know this is probably off the top of your head, so if you don't have the answer, that's okay. But how does this compare to the flu when we look at hospitalizations and mortality with younger children?
Thing, that's a great question. We get that. We actually don't track flu. Flu is not a reportable disease in the state of Florida. We look at Sentinel Surveillance for flu. So we look at syndromic surveillance when we look at what kind of people are going into the emergency department, and they have that ICD-10 coding for a chief complaint of ILI, influenza-like illness. But flu itself is not a reportable disease in the state of Florida. So we don't track how many people have flu. So if you go to your urgent care center and you get a rapid flu test, we wouldn't have that visibility. We don't have that, that privy of knowing what's happening. Yeah. So if you turn it over on the opposite side, it gives it a little bit of our percent positive rate. So it's our positivity rate. This is important to look at. Daily is not so much as important for me because, again, it's going to have that denominator number over the overall numbers that were reported in one day will affect positivity rate. It's more important to look at overall positivity rates, maybe taking a 7-day rolling average and looking at that. So if you look at overall for the last 7 days, in general, if we take the last 7 days, the 30th through the 5th, if I average those out, I don't have it on the top of my head, but if I average them, they're going to be under 10%. And that's the goal that we have been always striving for, is to get under 10%. If you remember at the beginning of this pandemic, our numbers were low and our positivity rate was low, or it could have been high, just depending. I remember when we first started testing, we were only testing symptomatic, or you had to be a certain age range. We didn't have a lot of capabilities related to lab and testing. And now we've been able to truly find what has been in our community. Back then, we weren't able to. We were really just testing the ones that were really sick, the ones that showing up at the hospital, and they were really sick by that point, versus now, anybody can go get tested. They don't have to have any signs or symptoms. They can get tested every day if they wanted to. We don't have any boundaries around that. So I think it's important to put that in your kind of in the back of your mind to be able to understand where we were at in March compared to where we're at in August. It's a very different picture. I truly can find now probably what's more likely has probably always been in our community because people have the availability of being tested. So I just want to keep that in perspective for you. And then the last section is that Sentinel surveillance that we're talking about, that syndromic surveillance, where we're looking at what are people going to the emergency rooms and standalone EDs for, emergency departments, and what are their chief complaints. So we track two things. Mainly it's that right-hand sign, those line graphs that we're looking for. So the top one is ILI, or influenza-like illness. We track those because they're very similar in some of the instances to COVID-like illness. And then COVID-like illness also has a few of those other things, such as shortness of breath, the new loss of taste or smell. Those are some things. So if you look back in mid-June, we were seeing a huge uptick in what those were looking like in our hospitals and our emergency rooms, and that was a concern for us. That tells us a lot of people are sick enough that they're going to the emergency room and they're seeking care, they're seeking treatment. And as you can see, for mid-July, we actually started to plateau, and now towards the end of July, we've actually seen a decline. That is really, really good news. So we do calls 3 days a week with State Surgeon General, all of us health officers. We look at the state data, and we have hit a plateau, or in some counties, we're seeing declines, not necessarily in cases, but COVID-like illness. We are seeing more of a plateauing effect in the cases. And please remember, deaths are a lagging indicator. So you're going to see cases rise and then weeks later see deaths because they don't happen simultaneously. It is a lagging indicator. Okay? Any questions about the data? This is where we were at as of yesterday. They come out in the morning. So you have the latest and greatest. Okay? The next handout, and you probably didn't get them quite in order, and so I'll show you. I wanted to show you where we were at related to our actual pediatric population that we've been serving. It looks like a diagram like this, a pie diagram. So I took this data to really look at all the cases that we've had because you are dealing with school-age children. So I said, let me give you the data on school-age children where we're at. So remember, I just said we had a little over 3,100 cases. So we have had a total in school-age children in this age range, and I took 5 to 18, knowing there may be a little caveat on the outward bands there. We've had 258 cases. Okay, I broke them down into elementary, middle, and high school, and I think I did those ages right. I live in St. John, so they're a little bit skewed with the elementary. So you can see we've had in the orange, the darker orange is your elementary. We've had 61 cases. That represents 24% of those 258 total. In the lighter orange is 42 cases in the middle school, or 16% of your cases. And then 155 or 65% of all of our pediatric cases have come in the high school age range. So I think it helps you make decisions with data, and that's why I'm providing that to you, so that you can see where you're probably most likely going to have some of those cases that happen as schools reopen, just because of their way they socialize with one another. Any questions about the pediatric diagram? I wanted to give you the data. This is your county. This tells us what we've had so far. Okay. The interesting thing about the pediatric cases that we've been tracking, talking to Terry and David, is really looking at, have we had any outbreaks and things that have been open? Because, I want to see if we've seen any trends. It's interesting because we've not had any outbreaks in summer camps. We've not had any outbreaks in any kind of sports or youth. I'm talking outbreaks, large number of cases. We've had a few daycare outbreaks, but they were like 3 cases in a daycare of, 50, 80 kids. So that, to me, it's still considered an outbreak under our case definition, but 3 cases is not considered an outbreak when most of the general public thinks of that. So I'm telling you that data, so we're not seeing issues. We're not saying any cases, because you truly are. You've had 258 in the county in this age range, but we're not seeing these large clusters. We really see more clustering in households. So mom gets it, dad's there, they got 3 kids. They're more likely to have clusters within a household. Okay. Any other questions about the data? They know I love data, so I think it helps us make decisions. I gave you a couple other handouts. I know one of the questions was about inpatient care. We do track that data with the hospitals. We have weekly calls. I'd be remiss not to talk about my colleague, John Ward, and all the support that he's given me through this. And so we do track inpatient care. We look at the number of vents we have along with the ventilator capacity. So vent is equipment we need. So we, as of yesterday, vent capacity was at 3, or we had 3 people on vents. As of this evening, it was 2 that are COVID positive. So it's a really, really good news. What we've learned is learned a lot about the disease process since March to August. When we were seeing this early on, we saw it as a respiratory illness only, and we've learned a lot about the diseases through all of the cases that we've interviewed, that it's truly not necessarily a respiratory illness. It does affect that, but it also has an inflammation process that happens. These people have a massive inflammation process that's happening within their bodies. Their immune system basically goes in this complete overdrive, and they actually have other issues that go on with other systems, your kidney failures, liver failure, those kind of things. We also do have some issues with coagulation. So a lot of these people, when they go in the hospital, they actually go on blood thinners and things like that. So we've learned a lot about that disease. A lot of people now, when they go in, they need supportive oxygen care, but they don't necessarily need a ventilator to survive. They need BiPAP, CPAP, nose cannula for oxygenation and stuff like that. So we're really treating our patients very differently today than we did back in March. Our index patient was on March 12th. So it just looks very different, the hospital setting and the care that people get when they do get sick.
And my question, somebody asked me something about the number of ICU beds in Clay County. And do we know where we're at right now with COVID patients within the ICU beds? Would that be the 12?
No, so this is total inpatient care. So yes, COVID in the ICU is 12. The key thing with ICU beds is we can take and convert rooms to ICU beds. So looking at truly how many beds are licensed as ICU, when you look at surge, you can also surge into your med surge rooms and those kind of things and convert them, versus vents is a little bit of a different issue with surge, because you only have so many of those. You can't convert something if you don't have it. So versus an ICU, you can take a regular room and make it an ICU room, which we have a little bit of capacity in that. So we've continued to monitor the capacity in the hospitals. We've continued to look at, are they able to treat these patients? Are they able to get them the care that they're getting? And I mean, we're seeing quick admissions, quick discharges, which is good news for us that, we're not seeing the cases like we did early in March. Does that answer your questions, Ms. Cole?
Yes, thank you.
Okay. So the next thing I wanted to talk about was contact tracing. This is always the biggest topic. We've been doing contact tracing. It's nothing new for us in public health. We've done contact tracing with all communicable diseases for a long time. That handout that we're going to go over looks like this. And all of these documents Terry is going to use and have within her realm of tools and her toolbox to be able to inform parents well, along with Nicole and what we have on the website for the school district. So contact tracing is not new to us in public health. That's how we do communicable disease tracking, especially when it's something that's spread human to human. We've done it in the STD world for a long time. It's how do I interview you? And, how do I interview you? You're the positive case. Who have you been with? Where have you been? How long's it been? All those questions that we ask. And then we inform their partners or whoever they've been in contact with, what the scenario is. We never identify names. We just say that you've been identified as an exposure. And so we've always done this. This isn't new for us. It's just a volume at this point with the number of cases that are coming in. So I want to explain to you how that happens. So we have a database called Merlin. Within the statutes of Florida, we have so many reportable diseases. Okay, it's a laundry list of those that are reportable by physicians and by laboratories. And so we collect those communicable diseases, reportable diseases. They go into our database, mostly by electronic lab records. We do have some that are faxed by physician's office and stuff. We collect that data, and then we work those cases. Working those cases, we make sure that we're meeting case definition. Usually those are defined by the Department of Health in Tallahassee along with the CDC. And then we interview those individuals, and depending on the disease that they have become positive with, whatever that is, if it's salmonella or E. coli or coronavirus, we interview them. We talk about, the exposure period, the incubation period. We talk about the risk of transmission. We talk about their household context, where they've been in the few days, whatever that incubation period is. And then we give them education on what that looks like, testing, all of that that preventative and treatment process. And then we make the contact tracing with the individuals that have been exposed. And offer them the same kind of education. What does that mean as far as isolation, quarantine? What does that mean about treatment, testing? Do you have to test, not test? All of that information. And we document all of that into our database. The interesting thing with coronavirus, because it's a novel, meaning new, we've never faced it before, even though there are 800 strands of coronavirus in the world, we have actually collected negative data. Typically, in communicable disease world, we only collect positives. I don't really ever know how many people test negative, but because it was new, we want to track that and figure out what's going on, what's truly the transmission within our community, how many people is it truly affecting. And so our database has been quite busy. 80, 90,000 cases of negatives and positives reporting into a database overnight can, make it slow down some, and we've been doing really well with that. And so that's the big scheme of contact tracing. It's not really controversial. It's not really difficult to understand. It's a really basic, it's self-report. I mean, it's who you tell me you've been around. I mean, there's no way for me to know if you're not telling me someone or you're telling me someone who really wasn't there. There's no way to know that. The interesting thing that we've been talking about through this whole process is how do we make that streamlined when you're talking about 38,000 children in a school district, and how do you do that? And so we have, talked through some of these processes, and I keep looking at Terry, but how do we do that? How do we have good communication to where we don't have people giving misinformation, but also how do we try to streamline that contact tracing part? That is our authority by statute to handle public health surveillance, to help handle communicable disease, outbreaks, investigations, all of that. That's where the authority lands in my shop. And so I want to make sure that we're very clear that's not a school district's role or function. And I will give you another example. If somebody is HIV positive, we don't come and tell the school district that. And then the school district, if you did know it, you wouldn't tell all their friends that they were around. That's not your role. That's not your function. And we really can get ourselves in trouble with HIPAA and FERPA related to personal health information. So we have to be very cautious about that. Not only because we want to do the right thing for them, I also want people to do the right thing for me also if it was my personal health information. So some of the things that we've talked about doing and we're going to be implementing is that chain up command as far as communication. Any questions or concerns that come up, they're going to go up to Terry Dennis and then over to my shop. I will get all those answers for them, respond back to her. And it's the same thing up my way, up to me, and then over to her. That way there's just clear delineation of communication so that we don't have these issues with, well, Terry said this way and so said this way. We're trying to delineate and make sure that we're really having some clear communication. Some of the other things that we've done with contact tracing that we want to try to help is actually is a great idea from one of the principals in one of the principal meetings that we had was that Focus, your system that you use, has the ability to upload seating charts. And I was like, that's perfect, because then I can see if student X is the positive and I can see them come into me and we interview them. They say, I go to school ABC, then I can go in and look at that school and see the seating chart, see the bus chart where they sit and look at what that exposure has been. We know that if we interview a middle school or a high school student and their parents allow us to do that, we're probably going to get pretty good information. It may be more challenging as we get lower in the grades with a second grader or a third grader to be able to get those names. They may only know Susie, not Susie's last name. That may become more challenging. Versus in the high school or in the upper grades, we know that would probably be easier. So we're trying to eliminate having you guys in the middle and making sure that we can do our work and provide that information. Focus was a great opportunity. We had been thinking, how are we going to do this? And a principal brought that up. Any questions about contact tracing? Hundreds and thousands of calls have been made. That's the only way I can say it. So.
I know sorry, that was loud. I know we've gone over it before, but just for everybody's information one more time, the parameters that you use to define exposure.
So I use the CDC exposure guidelines. So they're not Heather's exposure guidelines. They're not Department of Health. This is a CDC guideline. So it is within 6 feet, and with 15 minutes or longer is what they say. So if I walked up to you, said one word, and then walked away, or said 1 minute, that's not considered we're looking for prolonged direct exposure is what we're looking for. Because this disease is truly, it's not airborne, it is not airborne, it is not airborne. I cannot tell you that enough. It is from droplets. And that is from me talking, that is from me breathing. The more I yell or sing, the more droplets are going to come out. And they go out as far as you're exerting, and then they fall and they go down. We know more about surface areas as this has come along. It's not that they're not important, but we truly know that this is a human-to-human direct person contact or prolonged exposure with droplets. Okay? Yep. Okay. The next thing is a couple of handouts I want to go over and that we can use them. They just updated these, Terry, so I'll get these to you. One of them is I tested positive. What happens now? This gives you the idea of when we talk to a positive case, what information do we provide to them as far as quarantine, self-isolation, and all of that. It is interesting because we've always talked about 14 days, 14 days, 14 days. I know people have heard that. It's a little bit different for the actual positive case because they're already in the incubation period. So their incubation period may be a little bit different. So if I'm asymptomatic and I go get tested and I come back to positive today, I'm actually in my self-isolation. My time starts from the time I was swabbed because that is when the positive became. That's because it took me 2 days to get the results. It's when I swabbed. And there's few parameters they have to meet in order to get out of self-isolation. There's 3, and it's an and situation, not an or. I have to be 24 hours without a fever, not using fever-reducing medications, so no ibuprofen, Tylenol, Aleve, any of those. My symptoms, if I'm symptomatic, my symptoms have to have resolved or be really mild at this point. And it's been 10 days since my symptoms started, or if I'm asymptomatic, since I was swabbed. So it's an and situation. I have to meet all 3 of them. So it's real simple. So the positive cases, maybe back in your school, say it took them, they got tested on the 1st, they didn't get their lab results to the 6th, took them that long, and we notified them, they may be back in 4 days of school. And if there's a weekend in there, they'd be back in 4 days if they were asymptomatic. So 14 days isn't per se. I was giving you this information so that you know that your kids, not everybody's out 14 days. Now, those that they've had contact with are 14 days because we know the incubation period is 2 to 14 days. And because I don't know if they're positive or negative, if they've gotten it, they didn't get it, it's 14 days at home. Okay? Any questions about that? So these are the 2 handouts that we're going to use so that it's consistent messaging. This is what my staff uses, and it'll be also the information that Terry and Nicole can use with parents that have questions or concerns related to that information. So then we're consistent messaging. Same information from the health department is the same information from the school district.
Just so we're clear, because I've had this question from parents, there is no requirement as far as on the school district side for a negative test in order to return back to school. That when the health department notifies you to self-isolate, it's a matter of personal responsibility at that point.
Correct.
Thank you.
So let's talk about the testing. So if I am called today and said I've been exposed and I run out and get a test, I'm probably going to get a negative because I haven't been long enough in the incubation period. So an exposure is an exposure. It doesn't change the incubation period. It's still 2 to 14 days. Regardless if I get a negative or a positive, I still have to isolate for 14 days. It doesn't change the 14 days. So when you hear other school districts saying, I'm going to test everybody and all the negatives can come in, you may be getting a false sense of security that everybody is negative. Mm-hmm. So if you think about it, and I'm going to use an example, the White House uses rapid testing every day. They test everyone. However, we've heard some people have come back positive. So my question would be, how could that be? It's because they got false negatives in there. Because a lot of the rapid tests are antigen tests, and they have a higher false negative rate, okay? They're less sensitive, so they're not going to pick them up as much, okay? So you may hear some of those things, and it's not that it's not a good test. It's just not as sensitive as we'd like it to be able to pick up those. It also depends on where people are at in that incubation period, and there's no way for us to know where they're at because we're not testing viral load. We can't say, oh, they're at 500. That must be day 5 because they do 100 copies a day. We don't know that. We don't test that way. Okay? Okay. So talking about testing, I gave you a handout that says the different testing types because you're hearing a lot about that. So the regular test is a PCR test. What we're doing is we're picking up the genetic material from the virus itself. That is the normal way we test. Takes 3 to 5 days to get your results back. You come and get a nasal swab, nasopharyngeal or an oral pharyngeal swab. Usually takes 3 to 5 days to come back. And the reason we don't need a negative to come back is because I'm picking up the viral protein of that RNA strand of that virus, I could truly be not in the infectious period anymore, and I could still pick up fragments for that and still test positive. So after 14 days, we know that they're not infectious anymore. So we don't need to keep testing them. They're going to keep testing positive. I've seen people 6-8 weeks out still testing positive. They're not in the infectious period anymore. Huh. Okay? So that's why getting a negative It could be burdensome that you're actually excluding a child from getting back into the learning environment if you put that as one of your policies, because they truly could come back. We don't even do that in nursing homes anymore, so.
So, okay, putting it in layman's terms. I told you earlier, I taught 5th grade science.
Okay.
Let's say I test positive from the time I was swabbed, which could be 3 or 4 days ago, and I'm asymptomatic.
Okay.
Okay, so I then have the opportunity to go back to school for 10 days since I was swabbed.
Since you were swabbed, because that's
Okay,
when you became
so
positive.
I was swabbed and I got my results 5 days later. I stay home 5 more days,
As long as you remain asymptomatic.
asymptomatic.
Because
I'm
truly what we're
taking
seeing.
my temperature
Yeah.
twice a day.
Yep.
I don't have any temperature. I don't have any aches and pains.
Right.
I'm not taking any Tylenol, any aspirin, any Motrin, any
Right.
nothing.
You met all 3 of those ands that we talked about.
I just met all of 3 of those ands. I can go back to school.
Yep.
And this is huge because 2 months ago, they were saying you have to have another test and you have to test negative and we can't let you leave anywhere. Now, it's the symptoms that are key here. And so parents as well as teachers as well, I mean, we all need to be aware of those symptoms as well. So, and taking the temperature at home is important without the Tylenol, without the Motrin, without
Yes.
all of that.
Yes, ma'am.
But let's say I have symptoms and I want to feel better. So I'm taking Tylenol every 4 hours or whatever I can take to take
You
the
haven't
pain
met
away.
one of the ands. You haven't met one of the definitions.
Correct,
So,
correct,
right.
correct. But then I'm starting to feel better, and so then it takes a day, let's say, to, have a regular temperature. Okay.
Yep.
Thank you.
Yep.
Just putting it in
And
layman's
I'm
terms.
telling you the difference between a positive case and a contact, because that time frame is going to be different. And I don't want parents and teachers and you to be saying, well, this student's back too soon. That's not really your role or function. At the end of the day, part of this is a self-report, because at the end of the day, they could not tell you they have something and they could come. You wouldn't know. I mean, I would hope that everybody is honest and has good ethics and integrity, that they want to do the right thing, because we don't want other people sick. Because unfortunately, we just don't know enough about this disease to say, if it gets Ashley, she's going to be really sick. I don't know that. Or it could hit Ashley and she was asymptomatic. She's fine. I don't know that. And just because she's of a younger age doesn't mean she could not have a poor outcome. She's less likely, doesn't mean it's a negative risk.
I have another quick question. Let's say I am young family. I, used to take the temperature of my children, but I don't take the temperature of my children. Can't afford one of these fancy schmancy thermometers. Where can I get a thermometer if I need one?
Well, you can do the regular thermometers in your own household. We just wouldn't do that in a public setting. So you don't have to have a thermal scan.
But
You
if,
do
I
that-
mean, and a regular thermometer costs, how much do you think? I can't remember.
They're usually about $2 or $3.
Yeah, they're
Okay,
fairly.
I'm
I think
just,
you can
and
get them
I'm
at the
throwing
dollar
that out
store
there
and
because
stuff.
there are a lot of people that say, I don't have a thermometer in my house. So if it's not expensive, so.
So you
okay.
brought up temperatures quite a few times, and so I want to address that. Temperature checks is one of the tools in the toolbox. It is not the be-all, end-all tool in the toolbox. So as we learned more about this disease, that was almost one of the telltale signs now. Remember, 1/3 of all of them are asymptomatic. They're not going to have any of them, including fever. Of the 2/3, we don't know how many of those have fever as one of the signs or symptoms. So again, it is a tool in the toolbox, but is not the be-all, end-all tool in the toolbox, okay? It's not the only tool you have in a toolbox. We should have been doing some of these infection control things long before this happened, including if your child is doing something, you can kind of tell sometimes when they're off key. If they've never coughed and all of a sudden they're coughing, probably shouldn't send them to school. So just those are some of the things that we've done for a number of decades. Well, I mean, I think a lot of us are guilty if we've had children, and I'll raise my hand. And so, we need to be more cautious in the environment that we're in today with this pandemic. Okay. So the test, I just wanted to give you a copy of that because you're going to hear a lot of that school districts are buying rapid tests. They're going to have everybody's going to test. I want people to understand that there are cons along with pros to that implementation, that there are limits to what those tests can do, because all of the tests are only a snapshot in time. They're a one-time snapshot. When I pull that specimen, that's it. Doesn't tell me anything from that specimen moving forward. And so I think it's very important to recognize the limitations with these tests. Okay. And then the last thing that I just wanted to go over, and I gave it to you, was because the CDC, as we learn more, we have to change our guidelines. We have to update guidelines. And so the CDC is updating those guidelines as they come out. That's where you saw some few things change, Ms. Bola. You saw where we had to have negative tests. Employers are still asking for that. We were doing that for nursing homes. We kind of did that at the beginning a lot for the healthcare workers and essential first responders and those. We have now, the CDC doesn't highly recommend test-based strategy for discontinuation of isolation anymore. We are truly using symptom-based. So that's those 3 ands that we talked about based on if you're asymptomatic or symptomatic, meeting that strategy. And then also one of the big changes they did was that it used to be 72 hours fever-free without medications, and that was reduced to 24 hours. So, because if you think of what fever is, it is a mechanism of defense in your body. So we know that we're less likely to have an infectious process happening if we're not having a fever going on. Luckily for us, children tend to run fevers, adults tend not to run fevers. So when you're talking about the population that you're dealing with, they're more likely to probably run a fever. I'm not saying 100%, but it is the demographics that we're looking at in the population. So I gave you a copy of the latest ones that changed, and as you can see, they changed July 23rd. So that's where you're getting some of this switch that you had with related to screening. So one of the things that's in this document talks about universal screening, and the CDC does not recommend universal screening in a K through 12 setting. So we talked about this with the principals, and my thought process was, let's think about that being one of the tools in the toolbox that you have. But there's always limits to using something. And so my thought was, okay, if you choose to do that, how do you do it right? Because if you're gonna do it, you need to do it right, and you need to do it well. So how do you do that and do it well? So we talked about a lot of those factors related to how would you do it? Who gets trained for that? Who fills in if that person's out? Who changes the glove in between every student? Because that is the gold standard. How many pairs of gloves are you going to go through for PPE? Who documents? Where do you document that temperature at? Because that becomes part of the medical record. Who files that in all the medical records? Who has privy to all that information in between the time it's written down and then you get it into a chart? So it's not as simple as we're going to do temperature checks at all the schools. I think, as I expressed to Mr. Brodsky and Terry, I'm just giving you the tools. You choose if you want to implement them or not. I'm just saying there's limitations with that tool in the toolbox on a mass setting. If you're doing one classroom and that's all you had to do, it may be a different choice that you would make because those limitations would be outweighed. So that's all I had. I'll be glad to answer any questions. If I went too fast, you can call me anytime. I'll be glad to walk you any of those things through. You have fantastic staff. Terry Dennis has become a public health expert in COVID. She just didn't even know that. And she's gotten good because she calls me and she asks me questions and I'll say, well, what do you think? Instead of me answering like the what if scenarios, I say, well, what do you think? And she'll tell me and I say, you're right. So she's just calling for that confirmation. So that's good that you have that expertise within your own school district. And she knows to call me anytime there's any questions about things. And as these guidelines have changed from the CDC, we want to make sure that we're staying up with the latest evidence-based practice. Not what happened in March, not what happened in May,
Right.
What happened now.
Now, as you're doing the contact tracing here in Clay County, do you have any data that shows who tends to be the carrier? Because I know there's a lot of concern about children being asymptomatic carriers and that sort of thing. So do you have any data regarding that?
We have such a small subset, I wouldn't even be able to tell you that now. Looking at some of those household clusters that we've had, and I don't have my epidemiologist here, but we're not seeing that as the case.
Okay.
And the problem is it the chicken or the egg that came first?
Right.
Because if you test a whole household, you don't know who was first.
Right.
If they're all positive. You just don't know. So, and I've seen households where the parents are both and the children are negative. I've seen it vice versa. So, and then if they're all positive, there's no way to know who came first.
Thank you so much.
Sure, no problem.
And you've given us a lot to read and study and think about.
Call me anytime. You're more than welcome to have any side conversations. You just want to get up to date on any of that stuff. Terry is your inside public health expert on COVID, and we'll be glad to assist. It's going to be an endeavor, to say the least. I lastly would leave you as, not to be pessimistic, but to be a realist. You are going to have cases in your school. That is unrealistic to think that you are not. It is how we confidently approach this, and that we're going to do the best evidence-based approach to handling these cases as they go forward. Okay, thank you so much.
Thank you so much. We have some reading to do and studying in our spare time. Okay, there is no school showcase this evening. Last call for comment cards. If anyone wants to speak for 3 minutes. This is my last call. Okay. Okay. Then on the public comments, we do have one card. Someone who's not a stranger to us, Al de Jesus.
Would you like me to state my name and address for the record?
Yes, please do.
Al De Jesus. I'm at 155 Blanding Boulevard.
Okay.
Really, I was just driving back from a meeting this afternoon, and I thought I'd stop by. One, hadn't seen many of you guys in a couple of years, and two, just to, as a former teacher, admin AP, and a principal, and know pretty much everyone in this room, and speaking now more as a parent, I just wanted to thank you guys for the work that you guys have been doing together. And it's not been easy, I'm sure. I work in many different districts, and it's definitely not easy in any district you go into. But I just wanted to thank you guys for what you do. Now I'm speaking as a employee of the company I represent, Jostens. We are a Clay County-based company, and really we're just here to help out however we can. And thank you guys for everything that you're doing. That's it, really. Thanks.
Thank you.
And we have certainly missed you. Good seeing you. Okay. On the consent agenda, items withdrawn were C7. And I will entertain a motion to adopt the consent agenda.
Move approval?
Second?
Have a motion by Ms. Gilhousen, a second by Ms. Bola. It's hard to tell. Okay, all those in favor indicate by saying aye.
Aye.
All opposed say no. Motion carries 5-0.
Coming up.
Next is CCEA update. Vicki Kidwell.
Good evening. Had to brave the rain to get here.
You needed a canoe to get here tonight.
I'm glad I had an umbrella. My name is Victoria Kidwell. I'm president of the CCEA. I've been on the job for 8 days. You have my address on file. I wanted to start by thanking the school board members of Clay County and also the superintendent for your openness and willingness to work with CCEA, the voice of the teachers. We've not had much time to work together, but in that short time, I've seen that you understand the weight of your responsibility and my responsibility, and you take it to heart, just like I do. We have before us an almost impossible situation, and we have to safeguard the health and learning of tens of thousands of students and the health and livelihood of thousands of employees. Florida's districts are compelled to follow the emergency order from the state without any direction and without any funding. We've been told to open 5 days a week amid a surging pandemic at a time when our state's cases and deaths continue to set records. How can we afford extra staff or reducing class size or additional safety measures and equipment without extra funding from the state. That's something that we're all struggling to do and open safely. According to the governor's July 24th speech, and I'm going to quote him here, he said, "For those teachers who may be at higher risk or even those who just don't feel comfortable with in-person instruction, then they should be given the option of working remotely. Why force someone to teach if they're uncomfortable doing so?" But that's not the reality. The reality is we have nearly 200 teachers who are in high-risk categories, and they need to teach virtually, but we don't have student numbers to match that. That's real. They don't match up. That's the first of many terrible situations we've got to deal with. We've worked with the district to try to do all that we could possibly afford to make accommodations for our vulnerable teachers, and I thank you for that. It was a compromise. It was all we could afford. It's not everything that I wanted, but it was better than a lot. Some of those virtual teachers aren't going to have positions. There's not going to be enough. But we worked together to give them options for leave. And now we're struggling with the next big impossible situation, and that is what happens when teachers and staff get sick, because we know it's going to happen. Is the district going to be able to cover their sick leave? What if they become severely sick and hospitalized? They have co-pays. Our insurance isn't great. Co-pays are $6,000 to $8,000. You know, who's going to pay the deductible? How are we going to protect the welfare of our essential workers? We're asking them to be on the front line. Well, you know, our districts around us are also struggling with this, and we've been looking to our districts to try to show us maybe possibilities. And I know we're not a big district, and we don't have the funding that a lot of the others do, but here's some things that are happening around the state. Duval Teachers United is just worked with their district, their Duval County Health Department, their insurance carrier, and their county commissioners together to provide on-site testing for the teachers, which is awesome. They're offering paid sick leave for any staff infected and expanded health benefits covering co-pays and deductibles. That's a Cadillac right there. That's the Cadillac. And Lake County is working. They haven't settled everything yet, but they do know that so far they've got on-site testing, and that's super important when you have teachers go down sick, or you have an exposure, as Ms. Huffman was saying, to have these kind of options. So we're going to be working through those things and trying to find ways to protect our staff, ways to keep our schools open, and they're going to be difficult situations. They're going to be hard decisions to make, because I know it's not roses and lollipops. You know, we have very little funding. So I want to just throw something out here and tell you the thing that I'm dealing with right now. I'm looking at Dr. Legetgo's budget speech the other day, and it was wonderful. You know, the district has done really great. We're very solvent right now. We have good reserve fund. But that's not what I use to measure greatness by. It's just not. We've been handed an impossible situation, and the state provided us no additional funding. This is a crisis. This is the crisis that we all don't want to have, but we got. And so I'm going to ask you to look at your budget in a different way. I'm going to ask you to think about the people that are depending on you, and the people you depend on, and this county depends on, to educate and make Clay County a great place to live. Why do people move here? The schools. That's why. We have to protect our teachers, so we've got to look at our budget a different way. This is a crisis. Our teachers make this school system unparalleled. And so we're family here. You know, we know each other. People come here and they stick. And so I'm going to ask you to look at the budget, even though it's going to impact the budget, and think about this as a crisis, the crisis it is. What person in their family would allow their family to starve if they had money in their savings? You would never do it. If it was a crisis, you would pull out all the stops. Maybe we need to show the state what kind of crisis this is, that they've got to fund these kind of mandates when they send them down. 5 days open a week, do it safe and secure. How? You've got to fund it. We have to show them what it costs to open safe and secure. We don't want to be the next one on the news that's shut down because everybody's infected. We need small class sizes, we need social distancing, and all of that takes money. We need to protect our teachers, and we need to protect our students, and we need to keep our schools open. You know, our budget might take a hit. I can live with that. I hope you can live with that too. But you know what I can't live with? I cannot live with knowing that we could have done more to protect our teachers and our students, and we decided not to. That's what I can't live with. I hope that we can do everything that we possibly can, pulling out all the stops and treat this like the crisis it is and get through this together. Thank you.
Thank you. And next is the Cespa update. Lonnie Roberts. Thank you, Mr. Fossa.
Good evening to everyone. Is this on? Test, test.
Good
Okay.
evening.
Good evening to everybody.
Good evening.
Nice to see everybody. My name is Lonnie Roberts. I am, why is this on? I can't hear myself.
You're good.
Test, there we go.
Okay.
My name is Lonnie Roberts, there we go. I'm the president of Cespa. We've been doing this for about a few months now as far as COVID and having task force meeting, and I've been busy. This task force meeting, that task force meeting, and a lot of information has been put out, and I've put out a lot of information to all the support personnel. Lately, I've been asking for training for our custodians, and we finally got it. Thanks to Mr. Faso. He pulled off a great meeting with First Elementary head custodians. We went in there, listened to what the manufacturers of the chemicals that they used, and it all sounded good. They also explained more on how to use the chemicals, not dilute it too much, not to put too much in there, but how to directly dilute the chemicals in order to be effective. I was amazed at all of it. I thank him for that time to allow me to be there on both days. For them to come out of there and knowing just a little bit more, I told them, now you have been trained. You are a trainer now. Go train the custodians that's under you, because that is the most important part of it. And the reason why I did ask for this meeting is because, or this setting for the custodians, is because I did notice that some of the custodians did not have PPE on them when they was using the squirt bottles. They didn't have goggles on. And I asked them about the mask and the goggles. They said, do we have any? I said, did you ask for it? And I went to the head custodian. He says they don't want it. So at that one school, I did talk to them. They wear their PPE now. This is one of these times that you cannot go down on any custodian. That didn't come out right. You cannot have.
Okay.
You can. I'm having a sailor moment right now. You cannot have a custodian out on leave being sick right now.
Right.
We are still at least one custodian short average at every school. 3 custodians that I know in the past 3 months have left the district. Guess where they work at now? Panera Bread.
Panera Bread?
You know how much they make now
Uh-uh.
per hour? $12.57. Start.
Oh,
Start. $12.57 start. You know what they start here
uh-uh.
for a person just coming in? $9.58.
Oh dear.
$9.58. Yes, they don't have the benefits, but most young people don't have benefits. They come to work, they don't get sick the majority of the time without this COVID thing. But I've been asking for custodians forever. Me and Mr. Brodsky have been bargaining back and forth, and now that I think it's time, the district, I know, have to have some money this time around. Buses did not move this whole time, the whole summer. Diesel fuel costs money. You have money now. We need to move them out of that pay band of A13, A12, and move them at a respectable living wage. This must happen. This is crazy for somebody to go to Panera Bread and go work. Custodians, by far, are dedicated to their jobs. I can't get them to leave at night. I really can't. They are there every night to do their job because they know they're short, but they want to do their jobs and make sure the kids are safe. So they go up front, sign, and go back to work. They sign out and go back to work for another 45 to an hour and 15 minutes to finish up the work. They're short. There's too much for them to do. Now this COVID is here, and now they are expected to do this, do that, and being that all schools are different, you never know exactly what they're going to be doing. They have to take out trash in between lunch times. Then they got to come back, wipe down tables, and we found out that the most effective way for the solutions to work is that they have to be on there at least 5 minutes, 10 minutes. They have to, the table have to dry for at least 10 minutes to be effective to disinfect the tables. We don't have that time in between. There's no way possible to feed our children in that length of time that they already have. 10 minutes. It has to dry before it becomes effective. Otherwise, it's just sloshing the germs back and forth, and they come in and sit their tray down and start eating again. Okay, that's one of the things that I found out. I did not know that. I do that at my house, not no more. I use microband, and I still won't do it no more. I told the wife, let it stay there, don't move it, don't leave it. 10 minutes. Alexa, start 10 minutes. Alexa will give me 10 minutes. For real, she will. So with that being said, we are in what I call the perfect storm of COVID and less custodians. COVID and less nurses. Two 70-year-old nurses called me up and asked me about what's going on, how are we going to move forward here in the district with COVID. You know what they told me? After I told them, I don't know, I'm going to retire. I'm done. I said, well, you did not know. This is my job. This is my passion. I've been doing this for a long time. So they retired. They're not coming back. These are the experienced people that we have here in the district. Our custodians are experienced here in the district. Everybody here, matter of fact, all the support are passionate about their jobs. But the custodians, they need some love. The nurses, they need some love. Our maintenance department needs love. We are at 45% operation rate right now. Yes. Transportation, they need some love. They need more mechanics. They need to be paid for the certifications that they receive in order to keep those buses safe. Operating, the start, stop, put that stop sign out for the kids at the bus stops every single morning, to keep the lights on, to make sure the bus does not stop on the highway. In maintenance, everybody always talk about air conditions, but there's a lot of things behind air conditions. I do fire alarm, I do sound systems, I do intercom systems. My partners, co-workers that's in the shop, they do mostly fire alarms. We need more people in those areas. Electricians. Nobody wants to come and work as an electrician in the district because of the amount of money that's paid. Even if we give them 10 years experience, that only gets them to about 15, almost $16 an hour. But guess how much they was working for before they came in? 21. 21. With 10 years. They can do 21 years and get $21. That's a doggone shame. HVAC techs. We're not getting young people in none of these departments no more and staying for 25, 30 years. We're not doing it. I came here when I was, I was 42 when I got here. I retired out of the Navy. I went on my own as a subcontractor for AT&T. I got tired of hours. I needed to slow down. Felt like I was still on a ship. I was done. And I came here. So the right hours was right here for me. Fast forward 17, 18 years later, I'm still not where I want to be, but I love my job, and I like seeing the principals and assistant principals and the kids happy for having the enhanced classrooms fixed, to have the stadiums for graduation. We did a lot of replacing speakers for graduation. Clay High, they blew at least 3 speakers, and we had to put up horns, but you didn't know it. That's how good we are. That's how good we are, okay? And nobody was the wiser. We were told to make it happen. We had to think outside the box, and we made it happen. We got some talented people in this district, and I'm telling you, some of them are about 2 seconds from going to CXX right now in electronics. Right now. Electricians, we got a mass exodus getting ready to leave because of retirement, at like 3 people, and nobody is coming in. The pay scale that we have now has to be revamped. It has to. It was made back in whenever, before I got here, and as far as I know, it was there by probably 1990 or less. That pay scale does not represent what we are now. Everybody needs a living wage. Not just a pay, a living wage. With that being said, custodians felt a hard hit because the week of when we shut down the schools, they were called in. They were supposed to be paid double time and a half. It didn't happen. Why double time and a half? Everybody is at home getting their regular pay. When you call somebody up and you send them to go somewhere, that's time and a half. If I get called right now, because I'm on call, and I go work somewhere, that's time and a half with 2 hours. So if you call anybody out from their normal job, if they're sitting home and the school board is shut, they're supposed to get paid time and a half. It's in the contract. So with working with our people in HR, we made that happen. So now they are getting their time back. It's just the little things. It's just the little things that make people happy. Did everybody notice it? No. But I got at least 10 people that always call me and say, this is going on, that's going on, this is going on, that's going on. We need to make this happen. We need to get people paid. I know we got COVID on the mind right now. I have to change my hats every day from a worker to president of Cespa. And I got to do both. And then I got to take my other hat off, and I got to go home and become a husband again and say, yes, dear, for the rest of the evening, no matter what. So I hope this gives you something to think about when we go to negotiate. transportation, maintenance, nurses, custodians. Not any other certain order, but we must get that done. These are the main things that keep this county going. If no nurses, who's going to give the kids their EpiPen to go ahead and stop them from going in the shop when they get stung by a bee? Custodians go out, who's going to clean? Transportation people, they go out. Who's going to fix the buses? Who's going to fix the white fleet that I drive? Because I got to go around the county, and I got to take my truck and go from one school to the next school. And I serve all the schools. I don't have a designated area. Well, most of the people in maintenance don't now. We go all the schools. We used to have a designated area, but now that we've gotten so short, we don't have a designated area no more. So we may venture into one another's area and got to call and find out what happened here, what did you do here. But we try to get them in the same area. So just remember those areas, if you would, please, and show us some love. We need it. Thank you.
Thank you, Lonnie.
Thank you, Lonnie.
Okay, next is superintendent's update and presentations.
Okay, Lonnie, I'm pretty sure all of the hats that you wear have Pittsburgh Steelers on it. In fact, I'm pretty certain of that. I have a very brief update today. Tonight, I'm going to talk to you about the One Clay reopening plan, the 2021 student breakdown, how many students chose what option, our Smart Restart summer program, school preparations for the new year, and our Tools for Schools event. So let's talk about the One Clay reopening plan. Got some good news for you. Our plan has been approved by the state of Florida. They've responded back that we have met all the assurances that were needed to have state approval. Just a quick reminder, if everyone recall, on July 6th, the Commissioner of Education had issued an executive order which forced us to alter our plan that we originally were going to propose to a different format. Okay, on that day, essentially, we're going to offer a 5-day brick and mortar option to all of our students across Clay County. In addition, the district moved our calendar back to the 25th to help us prepare for what is going to be a very different school year. One of the things that I'm most proud of about the plan that we submitted is that it gives everybody options. As a parent, you can choose to send your child back to school in a brick and mortar fashion. You can choose to send them back in our One Clay online program. You can send them to a total virtual school called Clay Virtual School, or CVA. Or in the secondary level, you can do a blended model in which you have both brick and mortar and also virtual options. So one of the things I'm most proud of when you're in a difficult situation like this is that we let people make their own choice. What do they want to do for their family? I've answered many emails, as I'm sure many board members have, with families, and I'm just proud that we're able to offer those options to families so they can choose the option that best fits their family needs. The student breakdown. This is the latest and greatest information. As you know, there's some movement with numbers. So when it comes to Clay Virtual Academy, you can see that we have 825 elementary students that are registered in the system, totally complete. 511 junior high students, 747 senior high students, so that's 2,083. There's another 300 students that were waiting on some various paperwork, such as immunizations, birth certificates, proof of residency, those kinds of things. So that would be the number that we would anticipate to be in CVA once they're all in there.
Are those all Clay County students?
Those are all Clay County students.
Okay, so
Yes,
that
ma'am.
we didn't get students from other districts that enrolled in CVA?
Not to my knowledge, no.
Okay.
No. For the One Clay Online, elementary students, you can see we got about 4,080, 982 junior high, 1,464, total of 65, 281 additional homeschool students in comparison to the previous year, in case you were wondering how many students went homeschool. So when you add the numbers up, it's roughly 9,000 students, or 23 to 24% of our students that are going with an online virtual option. I just want to impress upon everybody in the room how big that is. It's not as big as other districts. Other districts have as high as a 50% enrollment rate in a virtual option. But just using our numbers of 9,000, or roughly 24% of our student population, that's the equivalent of opening up 4 brand-new high schools, all on the same day, or opening up 9 elementary schools, all on the same day. In that regard, it will require the movement of teachers and teacher positions and allocations, which is why we asked families to make a decision, and then we're trying to stick to those decisions so that we can have proper staffing of teachers for that 9,000 that have moved, 9,000 students that have moved. In addition to that, I would ask for patience from parents, students, and teachers as we all move forward. I'm trying to give a vision for how big a project this is so that everyone can see that this is a major, major event in Clay County school history. We're moving very well through it. I'm thankful for the collaboration with our teachers and our support employees and where we are in the process. But the 25th is right around the corner, and we're going to need to move steadfast in order to accomplish our mission, which is good customer service for our families in Clay County. I wanted to go on to another topic, which is our Smart Restart Summer Program. So we had over 350 students attend 7 different schools. So these are students that took school buses to Clay County schools. They ate lunch in Clay County school cafeterias. They had their classes in Clay County classrooms and then took the bus back home. And all of them, we had a bunch of testimonials from parents. On the right, you can see 2 that we snagged off of Facebook as to how parents were very happy that their child was able to go to school and participate in the program. On the left, you can see that we were actually on ABC Nightline and showed a video of our teacher there at Charles E. Bennett as she's teaching the class. You can see students in the front of the classroom there on the rug. Personally went and saw Charles E. Bennett and thought it was a model when I observed the cafeteria, when I observed their markers for social distancing, when I observed the classroom and the spacing of the desks and all of those things. I thought it was a model example of how to do this in what is a brand new world for us in education. So that's our summer restart program. School preparations for the new year. I'm about to show you a video. I don't think I can do that from here. I think somebody else has to do it. I don't know if there's any sound there, Ethan. So I guess what? I'm going to improvise. As you can see, you see the safety signs. You see the cafeteria spacing up there. These are all photographs of Clay County schools. See the social distancing markers where students would know to stand there. There you can see the talons. Almost every school has their markings for social distancing out there. Each school has a plan that's been approved. These are all part of those plans. You can see there's Fleming Island. I recognize the eagle on that one. That's an ingenious way to sanitize Chromebooks using plastic. Teachers are amazing. The band room setup. This teacher is narrating the band room at Orange Park Junior High, showing you the chairs that they're sitting in and showing you how students would enter the room and exit the room. He'll show you in a minute where students may have to use, he's showing you the X marks the spot below each chair, and how you can see that the band teacher has thought carefully about how I'm going to monitor students and how close they are in relation while in his classroom.
I don't mean to interrupt you, but you said Orange Park, and I believe that's Oak Leaf.
Oak Leaf, sorry.
Mr. Summers, awesome.
and he's kind of leading you for a tour of the room on his plan on how he would maintain social distancing, and I apologize for the sound.
And it was awesome because he also he sent that to me as well. And he's sharing this with all of the band parents. So everybody knows ahead of time. He's communicating very effectively with everyone.
Wonderful. How are they doing chorus?
Same sort of format. Here we're going into a cafeteria. You can see this is Poe's cafeteria. They're pointing out the direction of the cafeteria tables and the spacing of them to ensure social distancing to the maximum extent possible. And literally, we only took a few things to make a 2-minute video. Each school has its own set of pictures that they can show you as to what they're doing differently when it comes to social distancing at their school. And here you can see a classroom here with the spacing of the desks and how they plan to keep them apart. Okay. I guess the last event was the Tools for School event. It was an awesome event. We had about 800 teachers show up. They got some free supplies there. Want to give a shout out to Michaela Buchanan and the Clay County Education Foundation, as well as the Bailey Group and all the other sponsors that were there. It was a great event for teachers. They drove through there. They got a nice bag that was catered to elementary or secondary, depending on which one you were in. And you could see the elementary and the secondary, what they had. Who doesn't like free supplies? No one. No one. Everybody drove through, big smile on their face, and they definitely enjoyed it. And I thank you for your time.
Mr. Brock, I have a question. This is Janice speaking. Can you hear me?
Yes, ma'am.
All right. I'm concerned because I saw in the Tampa Bay Times today that Hillsborough County, Addison Davis is postponing brick and mortar, and his district is going back virtual for the first 20 weeks. Is it something we need to consider? Are we looking at that? Are we
Well,
prepared in case?
yes, ma'am. We're looking at that. The positivity rate in Hillsborough County is much higher than in Clay County. So remember, we're using information in collaboration with emergency management and our health department to make such decisions. But if cases were much higher within our district, we would have to consider that also.
And do we have a plan in place now so that if we do have to immediately go virtual like we did back in March, we'll be in a better situation as far as educating our students?
Yes, ma'am, we do. We've updated our ICP, so we feel like we would be able to deliver an even better product than we did in the spring.
All right, thank you.
You're welcome.
Thank you, Mr. Brodsky. And it was fun with the drive-through. Rain or shine. We were soaked and then we were blistered.
And I appreciate Michaela. I'd asked her ahead of time about coming to get some of the supplies for the 6 schools in the south end because a lot of those teachers don't get up there. And so she was very gracious, and I had when I realized, I think somebody said there was like about $100 a bag. That would have been, I took 30 bags for the 6 schools, 5 for each
Wonderful.
school. That'd have been $3,000 worth of supplies.
That's
that I was,
wonderful.
Took that. So new teachers and people like that couldn't get up there. So I'm very grateful. Thank you.
Those teachers were so good.
Yeah.
I mean, the smile
Very
on their
thankful.
face,
Yeah.
and they just kept saying, thank you, thank you, thank you.
The
I mean,
other shout out for that group is the Clay Chamber of Commerce, who worked very closely this time with the
Right.
foundation. It was an awesome event. I don't know who took the lead from Disney or whomever, but as the cars were backing up probably back to Blanding Boulevard for people coming in, they just opened another line, just carefully like
was
they do at
S's.
Disney, and let everybody come in. Another point, as a teacher, one of the reasons I used to always go to either the Clay Chamber event or the foundation event was for the ream of paper. And Office Depot had a semi that was supposed to arrive and pick up all of the paper and bring it pallets full of paper. And unfortunately, there was some miscommunication. So we didn't have those, but that's going to be delivered to the schools. So for the teachers who are
great.
listening, there's paper still coming, so important stuff.
Okay. Okay, next we have a resolution, D1, resolution condemning racism and affirming the commitment of the School Board of Clay County, Florida to an inclusive school environment for all. And Ms. Caracas will read the resolution prior to voting. All right, Ms. Caracas, this is your item.
All right, thank you, Mrs. Stoddard. I brought this last month. I had asked the board or advised the board that I wanted to bring this forward, and Mr. Bickner did a great job on tailoring this to Clay County. So if you would allow me, I'll read it before we move to approve it. Resolution 21-03, resolution condemning racism and affirming the commitment of the School Board of Clay County, Florida to an inclusive school environment for all. The School Board of Clay County, Florida, the board, acting as the governing body of the School District of Clay County, Florida, the district, finds as follows. Whereas members of the School Board of Clay County are saddened and outraged by recent events that demonstrated injustice and inequity, and whereas racism and hate have no place in our schools or our society, and we must protect the constitutional rights of every person who lives, works, and learns in our community. And whereas we must act to stop injustice based on race, ethnicity, gender, socioeconomic status, political affiliation, or zip codes that harms and anguishes people who are our family, friends, neighbors, students, staff members, and fellow Americans. And whereas education leaders are charged with ensuring that each of our children has equitable access to excellent educational opportunity, and whereas no student should confront bias, harassment, prejudice, hatred, or discrimination in our schools or communities, and whereas we must ensure that safe and enjoyable learning environments are established and maintained for all students in our communities, and whereas our district can be and will be a sanctuary of safety in our community and a beacon of light for the state of Florida and the world as we build and strengthen trust with those we serve and we model the acceptance of all people. Therefore, be it resolved that we, members of the School Board of Clay County, Florida, stand steadfast in our commitment to foster an inclusive educational environment where every student, teacher, support professional, parent, and community member is treated with the dignity and respect, as well as our commitment to continue fighting for justice and human civil rights for all. Duly adopted and approved by the School Board of Clay County, Florida, the 6th day of August, 2020. Thank you, Mrs. Stoddard. If you're ready, I'll move approval.
Okay, I have a motion by Ms. Caracas.
Second?
Have a second by Mrs. Bola. Any discussion? All those
I
in
actually had some discussion also. If you would indulge me before we take this vote, I'd like to read a section of Congressman John Lewis's final letter. It gave me chills when I saw it, and I hope everybody feels the way I do. He said, "It is my hope we are on our way to a greater change to respect the dignity and the worth of every human being, and it doesn't matter the color or background or whether they are male or female. We have come to that point and said, we are one people, we are one family, we all live in the same house, not just the American house, but the house of the world. Though I may not be here with you, I urge you to answer the highest calling of your heart and stand up for what you truly believe. In my life, I have done all I can to demonstrate that the way of peace, the way of love, and nonviolence is the more excellent way. Now it is your turn to let freedom ring." When historians pick up their pens to write the story of the 21st century, let them say that it was your generation who laid down the heavy burdens of hate at last, and that peace finally triumphed over violence, aggression, and war. So I say to you, walk with the wind, brothers and sisters, and let the spirit of peace and the power of everlasting love be your guide. Congressman John Lewis died July 17th. He was truly an amazing man. He dedicated his entire life to social and racial justice, and I would ask that each of you read his letter. Congressman Lewis's life would make an excellent lesson for for our students to experience. Anyway, thank you for indulging me. I know we can do better as a school district. We need to do better. We have a climate out there that needs to change. And I would hope that everybody would join me in agreeing with this. Thank you.
Okay, I have a motion by Ms. Kirikas, a second by Mrs. Bola. All those in favor indicate by
Could I
saying
have
aye.
Just one more, I just
Oh.
have one more
What?
item. First of all, I thank you, Ms. Kirkus, for bringing that to the board. And it's a time where it's a great resolution, but we need to put it into action and to put it into play. And that's what we all need to be doing now. And this is a time when we say we're all in this together, and we truly are, and we're one race, the human race, and that's what we need to all focus on. And thank you very much for bringing that. I appreciate it.
Any other discussion? Okay, all those in favor indicate by saying aye.
Aye.
Aye. All opposed say no. Motion carries 5-0. Okay. D2, appoint one board member and one citizen member to serve on the 2020 Value Adjustment Board. Who was on it last year?
I was on it last year, and I have just a kind of a point of order. I know in the past, and I enjoyed it. I thoroughly did. I learned a lot.
Who was the alternate? Do you remember?
I think it was Ashley. I think you
Were you
maybe
the alternate?
I'm not sure. I did it the year before,
Yeah.
and I might have been the alternate. Usually that's how we do it, right? You serve, and then you're the alternate the
I think that's
following
how it
year.
is.
Yeah.
But anyway, I know that we appoint a citizen. I would like to have. I know in the past we probably haven't a lot. The people aren't lining up to do this, but I think if. I think if we had some kind of criteria and we put it out on our website that said, because I think they have to be a business owner and that kind of thing. And I think that way maybe a little application, doesn't have to be a big thing, but an application process. And maybe if they knew, we might get some more people throughout the county that would be interested. So, because I know that there've been some that were on it, but didn't necessarily come like they
Right.
should. And I'd like
Yeah.
somebody who's truly interested in
What
doing
is-
it. But anyway, so that's.
I wonder what the deadline is to get the citizen appointed.
Well, I know you have to have the board member and the county commissioner, and I think they appoint a citizen as well. And so, maybe there's 2 county commissioners on it, but anyway. So
There
I
are
don't think you-
2 county commissioners, 1 school board member, and each governmental body, the commissioners and the school board, each appoint 1
Yeah,
citizen.
I don't know
Really to
what,
have a quorum, they need 1 county commissioner, 1 school board member, and 1 citizen in order to conduct the meetings.
what I don't know is, we can go ahead and get our member and alternate tonight, and then,
from the board, yes.
and then we'll,
Well, I think we've got some time if the county commissioners also get to appoint one, because they
Yeah.
only have to have 1. And I'd just like to put
Yes.
it out there so people
you're
would
such an
know.
optimist, Mrs. Bullock, and I'm sure they're going to line up to want to be the
And if I
citizen
don't, it'll be my
appointee.
bad.
If
we
I
have had
remember
that-
right, they don't meet till October,
They
right?
don't. I don't
Right.
think they do.
Yeah,
So we've
so
got some time.
we've got time. So let me ask you, ladies, and don't all speak at once. Who would like to volunteer to be on the Value Adjustment Board this year?
I can do it.
You will do it. Ms. Gilhousen has volunteered, and who would like
I'll
to
be
be?
the alternate.
And Mrs. Bola is going to be the alternate. See how nice and simple that was?
Very nice.
Depends on the date. No, I'm kidding.
Okay. Okay.
Mrs. Stutter, I'd like to echo Mrs. Bullock's recommendation. I think that's a good idea, too. I actually do have a name for tonight, but if we want to, just put it aside and actually advertise this position, the person whose name I'm bringing could go ahead and apply at that time.
That's what I
Want to go ahead and do it that way. I think that's a great idea.
We've got time, and so what? No,
could-
y'all are talking about advertising. You're not talking about paying for an ad in the paper.
No.
to do-
I'm just talking about
Maybe
putting
put
it
it
on
on
the
the
website.
online.
Say,
and
yeah.
then,
Yeah, just put it on our website.
We
We
can
can put
have
it on our
for the
website,
next meeting.
and then also all of us can be thinking,
And
and if there's somebody
and
that
we
we
call 'em
think
up
might
and
be
say.
good, we could call them and ask them would they like to volunteer.
So Mrs. Bullock will
be
have a lineup
considered.
of people.
Yes. Okay. We are. Let's see. We don't have to vote on that. Okay. Next is D3, Human Resources Special Action A. I'll entertain a motion.
I'll move approval.
Second.
I have a motion by Ms. Gilhousen, a second by Mrs. Bullock. All those in favor indicate by saying aye.
Aye.
All
Aye.
opposed, say no. Motion carries 5-0. D4 was withdrawn. Okay. D4A. This item has been added pursuant to Section 120.5252 Florida statute by the board chair. Good cause exists for this amendment and will be read into the record prior to taking any action on this item. Approve agreement, placement of one Clay online learning and Clay virtual academy positions. Before we open this up for a motion or take any other action on this item, I need to read this into the record. As the board chair, I added this item to the agenda because good cause exists to add it. The item is an agreement with the Teachers Union, CCEA. My determination of good cause is that, number one, this item must be approved before the beginning of the school year as it involves providing teachers to teach in the online programs. Two, it amends the existing practice of how priority is determined for assignment of positions and extended leave. Three, because of the existing pandemic and declaration of emergency, extraordinary means must be made available for provision of teaching personnel. 4, if this matter is delayed to a later agenda, it will not be in place in time to provide teachers by the opening day of school. 5, delay in approving the agreement would result in a danger to the public health, safety, and welfare of our students and the community, as it would negatively impact students' education and families in their ability to organize their work and home lives. 6, this item did not exist in time to place it on the agenda sooner, as it was created Wednesday, August 5th, 2020. Now, I will entertain a motion.
I'll move approval.
Second.
I have a motion by Mrs. Gilhousen, a second by Mrs. Bullock. Any discussion? All those in favor indicate by saying aye.
Aye.
All opposed, say no. Motion carries 5-0. D5, public hearing to approve as advertised modifications to the 2019-2020 student progression plan. I'll open the public hearing. Is there anyone here who would like to address this item? Then I'll close the public hearing and bring it back to the board. I'll entertain a motion.
I so move.
Second?
Have a motion by Ms. Bullock, a second by Mrs. Bola. All those in favor indicate by saying aye.
Aye.
All opposed, say no. Motion carries 5-0. D6, public hearing to approve as advertised the 2020-2021 Student Handbook and Code of Student Conduct. I'll entertain a motion.
I'll move approval.
Second?
Have a motion by Ms. Gilhousen, a second by Mrs. Bola. Any discussion? Oh, this is a public hearing. Excuse me. Got to go back. I'll open the public hearing on this item. Is there anyone here who would like to discuss the Student Handbook and Code of Student Conduct? Then I'll close the public hearing. Now, let's get your motion in a second again.
Move approval.
Second?
Okay, motion by Ms. Gilhousen, a second by Ms. Bola. All those in favor indicate by saying aye.
Aye.
All opposed, say no. Motion carries 5-0. Next is a public hearing to approve as advertised proposed revisions to School Board Policy 5.02A, Business Affairs Purchasing, 5.03B, Business Affairs School Activity Accounts, and 5.02C, Business Affairs Use of School Buildings, Grounds, and Equipment. I'll open the public hearing. Is there anyone here who would like to address this item? And I'll close the public hearing and bring it back to the board. I'll entertain a motion.
Move,
Go
ap-
ahead.
move approval?
Second.
Have a motion by Ms. Bola, and a second by Mrs. Gilhousen. Any discussion? All those in
Yes,
favor?
Mrs. Studdard, I'd like to discuss, or actually, I just want to go on record saying that I can't support this, that I don't agree with the limit of $100,000 for contracts. I think anything that's over $50,000 should come to the school board. Point would be last week at the budget meeting when the $3.6 million in CARES money was spent, and none of that was brought to the board for approval, including the $1.9 million for Chromebooks, that I'm still wondering who authorized that, because the board didn't authorize that spending. So I also believe that only the superintendent and his designee as senior staff should have the authority to approve contracts for anything up to that amount. So I want to go on record that I will not support it. Thank you.
Any further discussion? All those in favor indicate by saying aye.
Aye.
Aye. All opposed, say no.
No?
Motion carries 4-1 with Mrs. Karakis dissenting. Okay. Boy, this is the night for public hearings. Okay. Next is a public hearing to approve as advertised revisions to the Clay County District Schools Internal Accounts Manual. I will open the public hearing. Is there anyone here who would like to discuss the Internal Accounts Manual? Then I'll close the public hearing and bring it back to the board. I'll entertain a motion.
I'll move approval.
Second.
Have a motion by Ms. Kohlhausen, a second by Ms. Bullock. Any discussion? All those in favor indicate by saying aye.
Aye.
Aye. All
Aye.
opposed say no. Motion, did Ms. Carrick, you voted aye?
She did.
Okay.
I did.
Okay,
Yes.
motion carries 5-0. Okay. D9, public hearing to approve as advertised revisions to the Clay County District Schools Use of Facilities, Use of Grounds Manual. I'll open the public hearing. Is there anyone here who wishes to address this item? Then I will close the public hearing and bring it back to the board. I'll entertain a motion.
I so move.
Second?
Have a motion by Ms. Bullock, a second by Mrs. Bola. Any discussion?
Just that I want to say thank you to Dr. Legutko, because I think this was a long overdue thing that we needed in our district. And I'm hopefully, as people outside use our facilities, they'll realize what nice facilities we have, but that they, like anywhere else, we need to charge. So thank you.
Okay. Any further discussion? Okay. All those in favor indicate by saying aye.
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 All opposed say no. Motion carries 5-0. Well, that's all the public hearings. Now, our school board member remarks. Who wants to go first? Ms. Bola?
I just want to say, oops, sorry. I would just like to wish everyone a good start of the school year. Our next meeting won't come until after the start of the school year. I know all of you are anticipating lots of changes. Hopefully, there's some normalcy involved as well. Unfortunately, we're not sure what's going to happen with all of this. Definitely a wonderful event brought on by the foundation. Again, Tools for Schools. I know that the applications for grants for education are also due soon. If we haven't, I don't believe we've passed that deadline yet, but make certain that you get the grant applications in for that. I'd like to wish all of you a very good fall, good school year, and a genuine and heartfelt thank you. Thank you to the team in the county office for doing everything that you've done, Mr. Broski. It has been a remarkable 5 months.
Has it been 5 months?
Remarkable is the word. Between 4 and 5 months. And thank you to everyone, Lonnie, the whole staff, the whole custodial staff. Everybody has been phenomenal. Thank you for all that you all do.
Ms. Bullock.
I just have one thing. We received an email from Kathleen Hill, and I should have said it when we were talking about the resolution, and it was a one about working against racial bias. So she highly recommends that for like our new teachers and for everyone really. And I think that's something we should look at for all of us who got that email. If you'll, Mr. Broski, if you kind of take it, that would be a nice little training tool for some of our new people and that kind of thing too. So appreciate it. Thank you, Kathleen, for doing that.
Okay, Ms. Karakas?
I agree with Mrs. Bullock. Kathy Hill's email, I think that'd be a great training tool. I do want to ask the board, we know our FTE is going to take a drastic hit. Dr. Legucco told us we're going to be down more than several $1 million because of the virtual CPA students. And I'm wondering if, as a board, we want to draft a strongly worded letter to our DOE and the legislators asking and requesting that they continue to fully fund the FTE, even for those that are in Play Virtual, because we know those students that are transitioning just because of COVID will be coming back. And I think, it's something I would hope all the school boards were looking at and doing, and just think that maybe we should. So if, how does the board feel about that?
I'm in
Ladies?
agreement.
I'm in
I agree.
agreement with it.
Okay.
Yes.
Ms. Karakas, why don't you contact Mr. Bickner when he gets back from vacation? And,
All right.
and I'll talk to him and we'll get a letter brought back before the board for y'all to look at.
Agree.
Okay?
I'll do that.
I
I'll
think-
have him send it out to each of you so that you can make corrections or changes if you see fit. I think that's a great idea, and it shows that, we're unified front in asking to protect our students and continue to fund public education.
And I would just add to that, I think that those of us who have relationships with people in Tallahassee, we need to be burning up those phone
Yeah,
lines.
exactly.
How politely you say that. Yes, I agree completely. Okay. Are you finished, Mrs. Karakas?
The only other thing is I'd just like to say thank you again for allowing me to participate electronically. My husband was possibly exposed to someone in our neighborhood, and I didn't want to take the chance, so to err on the side of caution to keep everybody safe. I just thought I should stay in until we know for sure or what. So just want to say thank you, and I ask everybody to just remain safe and be careful. Wash your hands, do everything you can to keep yourself safe. Thank you.
Thank you. Ms. Gilhausen?
Well, I spent the morning ordering school supplies, and I can't tell you what joy that brought to me.
You can't drop them off yet.
I know. I gave you guys an extra 2 weeks. But all kidding aside, I know that there are so many emotions going into the opening up of school at the end of this month. So many people are fearful, and some people are excited. And I just would ask that we all continue to have a measure of grace towards each other, and know that everybody's home life looks different and everybody's needs are different. And so I think that, it's appropriate what we talked about, being inclusive as a school district and being considerate of others, and, that not everybody's perspective is the same. So I'm so impressed with the work that's been done in such a short period of time. As we go into a new school year with so many changes, this is a heavy lift. And especially to our administrators who I know so many principals probably were ahead of the game and got their rosters done early, when we went out of school in March, and now things have just kind of all gone topsy-turvy. So I know everybody is putting in so many extra hours and going above and beyond, and I'm so appreciative to the work that they're doing, and please know that your school board is here to support you. I had a teacher reach out and invite me to come read in her classroom to give her a break. And I'm excited to do that this
Me too.
year. And so if there are other opportunities, please contact us. We'd love the opportunity to read to your kids and give you a minute to step outside and catch your breath. So
Yeah. Well said, Ms. Gohausen. I too was invited to come and help out in a little people's class.
Uh-huh.
I love it. I can't wait.
Yep.
I appreciate what you said. And Mr. Brodsky, Ms. Dennis, all of y'all, with the principals, the teachers, the support staff, everybody has worked so hard to pull this off, to get school started again. I am absolutely amazed at the hours that y'all have put in day after day after day, making plans for a moving target. It's phenomenal what you have done, and we really do appreciate it. It's scary for all of us, but we're gonna make it. We're gonna be just fine. Some of the emails that we've gotten bring you to tears, because as you said, different people's homes are different. But I know the children are excited, and I know some mamas are really excited. But we're going to do everything we can to keep everyone in the school safe. We have made every kind of arrangement and plan known to mankind. We can't predict what will happen or won't happen, but we're going to give it our dead level best that we're going to succeed and succeed well, because we are Clay County and we're family and we pull together, and it's going to be just fine. So I want to say welcome back to staff, support staff, teachers, administrators, the kids, and let's move it along. And with that, the meeting is adjourned.